start recording. Go ahead, Shannon, and start your presentation, please.
Okay. All right. Okay, welcome everyone. Again, my name is Dr. Shannon O'Neill, a psychologist at Mount Sinai West and part of the neuromodulation team. One thing that I want to start with that I like so much about my position is that within this neuromodulation team, we are truly treating the whole person rather than just the symptoms. And there is a provider, a physician a long time ago who quoted, you know, a good doctor treats the symptoms, a great doctor treats the person. And I think with us as a whole collective team, we do a really great job at treating the entire person. Within this pandemic, you know, there's certainly no roadmap to how to handle these hard times, how to handle them appropriately. So a lot is really out of our control right now. And when that is the case, we are no longer able to change, you know, a situation. We are challenged to change ourselves instead. And so I'm going to focus on different ways within the mind and the body that can assist with just coping during this crisis. And I think this is something similar to what Dr. Capel said. This is something everyone can use, and you can certainly use these things more than just during quarantine at this time. So I want to start with structure. Being a behavioral psychologist, I really like structure. And so one important thing to keep in mind is to maintain a routine throughout your day. Having daily rituals that really anchor your time and shape your day can be really important. There was a story going around of a college student, you know, all college students are now at home, and a paper was due on Wednesday. And so, of course, like every other college student, put it in the back of her mind, didn't think about it for a long time. Days kind of started blending together, and the only time she realized that it had turned Wednesday, the day the paper was due, is that she saw Survivor on that night in the evening. And so, of course, frantically went to her email and emailed her professor that her paper was going to be late. So instead of being like an individual who only gets cued by TV shows to know what day of the week it is, having specific structure throughout the day can be helpful. This quarantine can really mimic symptoms of depression, even if the sadness isn't there necessarily. The rules and regulations are, you know, staying home, isolating, not being outside very much, and spending very limited time with other people. Those are all symptoms that are reflective of symptoms of depression. And also that can impact sleep as well. So there's certain things that can be done within the day that not only assist with boosting your mood, but also impact your ability to have quality sleep at night. And so one of the most important things is consistent wake time. Regardless of your sleep the night before, if you're feeling pretty crummy, getting up at the same time every day and exposing yourself to that early morning sunlight can cue the sleep regulators to get going so that you can start to have your body become more and more tired throughout the day. Avoiding napping, too much sitting around, dozing off in front of the TV, all of those things are really tempting, especially if your life has really slowed down at this moment. But it's important to monitor that, try to get moving, be creative with moving as much as possible. Of course, monitoring caffeine. One thing that I mention to my patients is usually after 12 p.m., I would cut off caffeine if possible, and keeping that medication routine. I think for a lot of people with movement disorders, that medication routine is a way to anchor your day as well. On the side, this is just a little clip art to show of just like a habit tracker. A lot of people want to start engaging in specific behaviors that they want to start doing regularly and forming new habits. And that's something else that can be done during this time to kind of keep more structure throughout your day. The other time, of course, nighttime. There are certain things that can be helpful in starting to wind down your body at night, especially with all this news and this media and the nighttime news. it can really start to overactivate your mind and keep it really active late at night, whether it be with worries, concerns, ruminations. And so similarly of having a structure during the day, having a structure at night can be helpful. Putting the day to rest is one of those. So with putting the day to rest, this can be putting out your coffee for the next day, checking on any appointments that you have, maybe making sure electronics are charged for VTEL appointments, whatever it is, starting to focus on just winding down your day and how you put your day to rest. I have a lot of people who they close out their day by making sure their doors are locked, dimming the lights, whatever it is. And creating a buffer zone, this is somewhat similar. This is about 30 minutes to 60 minutes before bedtime, having this time be a wind down time. So this could be, again, dimming the lights, turning off electronics, making sure that everything is put in place so that you're able to fall asleep at night. This shouldn't be a time that you're playing video games or being really overactive with like a sports game or a comedy show that's too overstimulating for you. It's time to do something a little bit more mindless, not a time to do chores or anything that's really active. Of course, staying out of bed until you're sleepy. Sometimes I think this is difficult to gauge, especially with movement disorder patients, because bodies can be so fatigued physically a lot of the time. However, if you could try to distinguish between when your body is physically fatigued and when your body is feeling really tired and sleepy, only then would I encourage you to physically enter bed, because that's the most optimal time that your head's going to hit the pillow and be able to fall asleep. And then, of course, if you are laying in bed and you know your body, it's not going to happen, sleep's not working out right now, I would encourage you to get out of bed after 20 minutes, but not before. Sometimes people catapult out of bed due to frustration. I would try to ease your body into bed to see if that works. Throughout this presentation, I'll have little phone apps that are really helpful for certain topics that I'm focused on. CBTI Coach is one of them that can be very helpful for sleep. I did a lot of my training at the VA, so all of these are VA related. And so you'll see that if you download any of these apps. The other thing I want to focus on is connection. So what has been going around is really focusing on not just social distancing, but physical distancing while remaining connected. So isolation certainly doesn't have to be a time for loneliness. It can be a time for solitude or getting to know yourself without all these outside influences. When the world starts winding down or slowing down, who are you outside of all of this outside stimuli? And so it's a time not just to connect with others, but to connect with yourself. And so this can be a moment in our time that we take inventory of what we really value. And so if we think of values, these are leading principles. They guide us, they motivate us, and they really focus on how you want to be to yourself, to other people, and to the world around you, how you want to relate. If I could give an equivalent, so values are, if you're going on a journey, values are heading north. You're going in the direction of north. And goals are the river that you cross along the way, the valley that you travel through. Those goals are things that can be crossed off, whereas a value is constantly guiding you. No one ever reaches north. You're always guided there, you're walking in that direction. And if you're continuing to walk in the direction of your values, that's where it feels as though just mental well-being is. If people are living in the realm of I'm constantly chasing goals, once that's crossed off, sometimes you're feeling less fulfilled and looking for the next thing. Whereas with a value, that is never ending. You can always exude something from your values. And a good way to try to exercise, an exercise that is helpful to think about what your values are, because a lot of people don't necessarily take the time to think about this, would be to identify an admirable person in your life, whether it's a celebrity, a public figure, or someone close to you that you just truly value and admire. And I would emphasize that this isn't related to their appearance, their wealth, their status, but what is it about them and the qualities that they exude that you like? And once you're able to answer those, that's when it's easier for you to tease apart, okay, maybe these are characteristics and qualities that I value as well. And so you can see on the side, these are just a few life domains to start to think about. Of course, there's plenty more than this, whether it be community, recreation, um, parenting, being in a partnership, whatever it is. Focusing on, for example, with friends, if I could be the best friend possible, how would I behave in that relationship? And that's where your values fall. Again, this is from a theoretical orientation called ACT, which is acceptance and commitment therapy. And a lot of what it focuses on is moving in the direction of your values, regardless of the distress and the physical discomfort and the pain that you carry along the way. Because when you get off course and you're not walking north towards your values, that's where the psychological distress lies. So it's constantly getting you back on that path. And so you can see a phone app down there, ACT Coach. It has a lot of topics related to values. And of course, the other that we're focused on is connection with others. And a lot of people are, Zoom has been a major platform right now. And focusing on how you can stay connected with other people is really important. So there is ways to, of course, socialize virtually, learn. I know a lot of college courses that are being taken by other people, being creative, learning a new skill, whatever it is, and contributing. Even with technology, you can send a meal to frontline workers, whatever it is. So making sure you're connecting the best way possible. However, I also really want to emphasize the alternative, knowing when it's time to disconnect and turning off social media and taking a step away. Because I think what is very common right now is comparison. And our society, who is really, really obsessed with productivity and having to have new skills and having to learn something and maximize our time during this pandemic, that can add a lot of pressure to people who might be struggling with what's going on as well. So it's important to remember what's happening right now is a collective trauma experienced across the world. It's impacting everyone. So your natural emotions that you're feeling, I would really tap into some self-compassion associated with that, because you're experiencing it for a reason. The quote I have on the side here is from a man named Viktor Frankl, and I'll speak about him later on in a few slides. He is a psychiatrist who survived the Nazi concentration camps. And he wrote, "An abnormal reaction to an abnormal situation is normal behavior." So if you are not waking up for that virtual yoga or connecting and having virtual happy hours, learning a new musical instrument, and you feel okay and that's your reaction, then I say continue to do that, because there's no sense just trying to keep up with it, how everyone else is coping as well. Okay. The other two I want to focus on is mindfulness really briefly, and then of course just ending with making meaning out of this. So what I often tell my patients is to really focus on, if your mind is spending a lot of time wandering to the past or past events, that's where depression lies. If your mind is spending a lot of time in the future, that's where anxiety can be. All the unknowns and the uncertainty of how this is gonna map out in the future. Staying present is so critically important to just have peace of mind. And so in order to get there, to be present, really focusing on relaxation can help. As simple as just tapping into your breath and being grounded to the moment, in the moment. So if you start to get spiraled into these what if moments of what if this, and this, your mind is already weeks and weeks ahead, months ahead, years ahead. And that's where anxiety really starts to build up. So I would start to reel you back in by paying attention to your breath, grounding yourself to your surroundings, and really focusing on reducing that nervous fight or flight emotions that you're experiencing internally. An important thing I'll note that I have previously taught this to a lot of veterans with PTSD. And what I noticed from the exercise of just simply deep breathing, what was often taught is that through the cycle of the breath, everyone really focuses on the inhale and trying to fill their belly as big as possible and with as much air as possible. However, the most critical part of the cycle of the breath is the exhale. The slower you can exhale your breath and really start to calm yourself with that exhale, the more your body, with all the other internal responses of your heart rate, your blood pressure, that is tapped into that part of the cycle of the breath. So really focusing on the exhale is important. And so I want to show you a little GIF. So GIF, this is just a breathing GIF, and it can be very helpful. I'll let it play a little bit. This can be found on any, just searching Google on your phone. You could say breathe in, out, GIF, and you'll find this animation that you can save to your phone, and it will just end up in your camera roll. And what's cool about it is that any situation that you're in, if you're managing the subway system, if you're waiting for your doctor's appointment, waiting for results, whatever it is, this is something that's really discreet, and you can just pair your breath to it rather than having your mind start to spiral or race into the future. Another one, just because I love all of these are some apps on the side that you can see. These are all breathing apps, relaxation apps. And this one, I think it's going to redirect us, if you guys can see this. This was actually made for COVID-19 as well. And you can, if that GIF was a little too fast for you or too slow, you can start playing with this to focus on, okay, how long do I want to inhale versus exhale? And so if I set it up that we inhale for 6 seconds, but we want to focus on exhaling a little longer, it will do that for us with this circle. And again, similar to the GIF, that it's really helping you model how to breathe and mapping to your breath of what is most important for you of slowing down your breathing. So just another thing, I think it's called Breathe Machine, and it's also free. Okay, let me go to the next. All right, so the other thing I want to focus on in terms of mindfulness is recognizing that all of us carry distorted thinking from time to time. We're human, we're alive and breathing, and so we are going to have automatic thoughts that are not pleasant. I would keep in mind the 3 thinking traps that I have up at the top. So over magnifying the negative, focusing on disqualifying the positive. So, oh, it doesn't count, minimizing it, not considering it to be something as equally positive as you experienced something negative. And then overgeneralizing. So this single negative event is just this never-ending pattern for you. When you start to notice that your types of thoughts or the content of your thoughts are really zeroing in on the negative around you, or overgeneralizing it of this always happens, that's usually a good cue that you might need to take a step back and balance your thinking a little bit more. It might very well be true, the things that you're seeing and the things that you're thinking. However, in order to make it more balanced, is there other aspects that you're not seeing as well? And so I recently started doing this, and this is a phone app. It's called 3 Good Things. And it reminds me every night at 9 p.m., what are 3 good things that happened today? Because within this constant state of just anxiety within the pandemic, it's very easy to have a negative cloud over the experience of the entire day. Or if you just had one bad thing happen that day, that can just mask everything else that happened. And so to take a moment just to reflect on what else was going on in my day that was positive. And I noticed that a lot of the things are simple. You know, it's not always these like, oh, I completed a marathon. You know, it's not these huge, grand things every day, but the simple things I noticed I have really taken for granted until they didn't work. So a good internet connection during this webinar, that's something that I'm certainly going to add tonight if that keeps up. But really focusing on more than just the negative can be helpful in expanding your perspective at this time too. All right, I'm gonna go to one more slide for you. So this is, I think I mentioned this to so many patients, and I've had wonderful, rich conversations with a lot of patients about this book. And so if you're thinking of one thing to start doing and trying to do something virtually, starting a book club with this book would be, a Zoom book club would be a pretty cool start. I have referred this to so many patients, I bought my own copy, because it had been a while since I read it. So I figured I would start reading it again. So Viktor Frankl is a psychiatrist who created his theory of what causes meaning and purpose while he was, at the time of him being a prisoner of the Auschwitz concentration camps. So he developed a theory at the same time. I often promote with my patients with a new diagnosis of receiving a new movement diagnosis, or, you know, motor symptoms are really bothering them at that time, really encouraging them to find meaning or purpose in what they're experiencing. My words can only go so far sitting in this chair and not in their shoes. However, someone who has faced such difficult circumstances in their life and still finding meaning and purpose out of that, I think what better person to share their experience than Viktor Frankl. So he was on a quest to find meaning and find purpose during the most challenging times. And he discovered that meaning came across from three different sources. And we actually touched on some of them today. So value, or I'm sorry, love. So I think with love, it is connecting with yourself, connecting with others. Purposeful work. This could be what you value, what is purposeful in your life, how you want to exude yourself and what you do value. And then courage to face the difficult times, whether it is COVID-19 or receiving and managing a chronic diagnosis. Those sources are what generate meaning. And so I want to end with a quote from Frankl that I think speaks to this current challenge, as well as speaks to anyone who is managing long-term a movement diagnosis or a chronic condition in any circumstance. I think this kind of really speaks to those people. So he wrote in his book, while at the concentration camps, he said, "Everything can be taken from a man but one thing, the last of human freedoms, to choose one's attitude in any given set of circumstances." And so I will end it there. Some, words to think about. And I will hand it back over to, I believe, Dr. Gupta maybe, so that we can answer maybe some patients' questions as well.
Wonderful. Well, Dr. O'Neill, thank you so much. Especially in this day and age and what we are all dealing with, that was really, really important. I'm very familiar with Dr. Frankl's work as well, and I think it's just really brilliant to end on that note in terms of how, what the quest for meaning means in all of this. One of the things I think that our center really practices, as you know, is that you cannot be physically well unless you're fit emotionally and mentally well. And so that's where I think sessions with you and really having someone like you is such an invaluable resource. Could you let us know if someone does sort of undergo or sign up to be under your care, what is that like? What are the meetings like? How many? What should they expect? And can you do this online via telehealth?
Yeah, I mean, that's a great question. And I think we have now proven, we have been forced to prove that we can do this online now. And it feels as though the team hasn't skipped a beat with being able to still manage a lot of our patients virtually. And that certainly still can be the case going forward. What I like about the team is that it can be so flexible of what the patient needs in that moment. So if a patient needs a one-time appointment just to get some questions answered about how do I manage my medication, or focusing on structure like we talked about at the beginning, that can be certainly one thing. But I think the expectations for therapy in terms of a neurology clinic is to really focus on how do we enhance someone's quality of life going forward while also managing a chronic diagnosis that gives you limitations realistically throughout your day. And so it's very individualized. It focuses on what the patient needs in that moment. And of course, pulling all people in as needed. I know Dr. Fagee, our psychiatrist, is also works very collaboratively with us in order to make sure we can just give all the comprehensive care possible.
I'm really glad you touched on sleep. You know, as we tell all of our patients, one of the biggest ways to live well with Parkinson's or any other movement disorder is sleep is at the forefront, as well as exercise and diet and wellness and things like that. For an individual that has a movement disorder, such as Parkinson's, and they follow all of the habits that you sort of outlined for sleep hygiene and wellness, but you know, are really physically still bothered, what are some recommendations that you can make just for the physical manifestations of difficulty with sleeping?
Yes, I agree with you, Dr. Gupta. I think not only within my practice, but also in current research right now, the number one non-motor movement or non-motor symptom for a lot of our Parkinson's patients is sleep and the difficulty with sleep. So I agree, you could do every single one of those things and keep yourself moving throughout the day and have this structure at night, but the positioning in the bed can still be so uncomfortable. So taking a look at, you know, making sure the environment is set up for optimal sleep, whether it be really, really dark, making sure it's cool enough, having white noise machine on, essential oils, whatever it is. I think also being a little creative with, you know, having a mattress topper or a body pillow to get into a comfortable position. I was recently looking up, man, so many of my patients say they wake up in the middle of the night and they're so stiff that it's difficult for them to move around and readjust. And although not ideal, I mean, no one wants to have to accommodate this much. One of the recommendations was satin sheets as well as satin pajamas, because the lack of friction there can assist individuals in being able to reposition just a little bit better.
That's great. You know, I think I remember that when I was a fellow, that's how I learned about that, as a patient had said, oh, I have it solved. I put on my satin pajamas and have the satin sheets, and I, you know, move around at night very comfortably. So that's interesting. You know, I'm hearing from a lot of patients, and by the way, anyone who's on that may have a question, please, you know, utilize the chat button if you would like. This is supposed to be an open forum, but I'm hearing from a lot of my patients that say, well, how do I know what's just normal anxiety related to either the COVID situation, the social distancing, or just, you know, anxiety about other factors? How do I know if I can manage it myself, or when should I see a specialist?
That's a good question. I think if it's pretty ongoing and feels as though it's getting much more chronic, or the symptoms are getting much more debilitating in a way that it feels like it's difficult to manage with just the skills that you've been using for so long, that's a time to reach out. I think that a lot of people have been coping for so long, for really well for so long. And once a crisis occurs, sometimes those coping skills that did once work are no longer cutting it anymore. And I think that's when a patient knows, okay, this is a time to get just additional help, even if it's short term. And that might be to change perspective, focus on additional behavioral strategies, whatever it is, or just have an additional pair of ears to hear you out at this moment.
Yeah, that's an excellent point. And again, along the lines of living well with a movement disorder, I advocate to all of my patients, obviously, the exercise. And people think about the physical exercise and even what we can do right now with social distancing. But can you give us some tips on potential mental exercise? Any type of mental activities that you really would recommend that patients can benefit from?
Yeah. Aside from, so I really do like the 3 good things in the gratitude app. Aside from that, one thing that I have been noticing is that even though, again, I don't want people to learn a new skill if it feels as though that's another thing added on my plate, but an activity that's a little bit more novel to you, or something that feels as though you don't do it too much, so you have to pay attention to it. That's a good way to exercise just you placing your attention on an activity that you can't distract from. You can't do it mindlessly. You have to focus on it. And in that moment, that takes you away from all the other chaos going on around you as well.
Yeah, I think that's a really good point, sort of about being mindful with any type of mental exercise. Even if I have a patient who says, well, I read, or, I'm watching a lot of, documentaries or TV, I always say, well, you want to take it in, but you also want to get it out. So if you do kind of read something or watch something, journal it or talk to someone, really kind of close that loop. And I totally agree. It's hard to learn new skills, especially now, but even if it's just putting together a new meal, or
Yes.
doing something with your hands, a puzzle, or things like that, I think it's great. But that's very important to be mindful. We have a question.
Can I ask a question? Let me ask a question first to Shannon, because I want to comment. In this sort of isolation moment that we're all going through, Shannon, it's really interesting in your presentation, which was excellent. You made no real direct recommendation, I'm going to be cheeky here, to do more social media. And what's really interesting, that in this moment where we're all isolated, something called social media didn't really rise to the challenge. It didn't really bring us together. I think it really highlights that social media doesn't, or at least traditional forms of social media, don't in fact bring us together. Maybe you can make a little, as opposed to something like Zoom, which is really more like human interaction, where you can see, you can talk, you can do so on. So can you comment on that a little bit, about what that might be going on with that?
Yeah, no, I certainly agree with that. I think our technology, similar to us getting on virtual platforms, all these platforms advanced so rapidly during this time, when all our social media kind of stayed the same. There was no new innovative experiences happening there, whether it be Facebook or Twitter, but all of these other platforms that were ways to continue to connect and to reach as many people as possible were. And I think that's a good way of hoping this sticks around, so that, I've heard from so many patients that when I'm checking in of them quarantining at home, they're like, this is nothing new to me. This is something I have experienced for so long because of the limitations that I experience. This is a taste for the general population to really understand what is normal for me. And so maybe once recognizing that from other people in society, they can start to be more conscientious of connecting to people who are staying at home quite a bit more, so that they can have these platforms too to communicate through.
Yes, absolutely. And I think that's a really valid point, maybe to utilize social media in a beneficial way, whether it's scheduling phone calls with loved ones that you wouldn't have done before, or really trying to, connect, even though we are distancing. So I think keeping that at the forefront is very important. There's a question in the chat box about you talked a lot about sort of mood and feelings. What about the other extreme, which is fatigue, which is a great point and very multifactorial?
Oh, that's such a good point. This actually brings up a lot. So for chronic fatigue syndrome, I'm not sure if there's any specific questions of how to continue to stay active or motivated with experiencing fatigue. But first of all, if this is acute, taking the time to, experience that fatigue, or recognizing, listening to your body of maybe why is that happening in this moment for you, that's important as well. However, there's also this thing called time-based pacing. And this is for individuals with either chronic pain or have windows when their medication all of a sudden really works for them, or there is such chronic fatigue that they need to start chipping away at things, but not sure if their body can hold up to that occasion. So it really focuses on, rather than your body telling you when to slow down and when to stop, usually that crash and burn, focusing on pacing out things with realistic intervals of time. So once that timer goes off, and again, this could be 5 minutes. I'm going to tackle this task for 5 minutes. Once that alarm goes off, I'm going to rest for 10 or even longer, whatever your body needs in that moment. But it constantly is having you move, and the timer is telling you when to stop rather than it getting to the point that your body is telling you when to stop. Because at that point, when your body's telling you to stop, it's already too late and you've probably overexerted yourself. So really breaking it down by time rather than focused on physically.
It's very interesting. And we know with movement disorders, particularly Parkinson's, patients have difficulty staying asleep. A lot of them can fall asleep okay, just that they're up every couple hours and up again. And I get this question quite a bit, and I'd be curious to hear your perspective. What should a patient do if they're just lying in bed and they just are not sleeping, or they've woken up and it's beyond that 20 minutes?
Yeah.
Should they just stay there? I mean, you hear lots of different things. Should they get up? I mean, well, what are your thoughts?
Yeah. From, again, a behavioral psychologist who really appreciates good quality sleep, I would encourage you to get out of bed. If it's not happening and you're laying there and you're tossing and turning, and the moment you start trying to sleep, again, that's so counterintuitive for your ability to just naturally fall asleep. So getting out of bed, doing something else safely, whether it be on the couch or doing something around the home, I would encourage you to do that, because the longer you're laying in bed awake, the more you're conditioning that piece of furniture to wakefulness and not sleep. So anytime it's been too long that you are staying awake, try to disconnect that or unpair it from your bed in order for you to do more things until, again, you're sleepy enough, and then try your attempt at bed again.
Another very good question about alternatives to recommendations for exercise. One thing that I'm so proud of the Parkinson's community is just such a great night is for exercise, whether it's, big and loud or LSBT. But one of the ones that really sticks with people is rock steady boxing, which I think is phenomenal, and it incorporates mental and it incorporates physical. If anyone is on that, can either put in the chat box, what they're doing for recommendations, or if anyone knows of a virtual rock steady program, that would be great. But some alternatives to the traditional exercise paradigms. Any recommendations there?
Yeah, I mean, one thing that comes to my mind is that I did a lot of modified activity or modified yoga with patients when I was doing health psychology at the VA. So there's so much on YouTube. I'm not sure if many people have explored that platform, but there's a lot of modified ways of still stretching, opening up your body, while still doing it, whether it's seated or kneeling, whatever it is. They have a lot of modifications for individuals, and that can be found on YouTube. Other than that, I really encourage, just in that window that you're feeling good enough, to get outside to walk, because not only are you really driving up that sleepiness throughout the day by staying active, you're exposing yourself to that sunlight, which is so important for the daytime, rather than kind of staying enclosed in dark spaces, because that's when our body gets off with our circadian rhythm as well. So anytime you can expose yourself to that sunlight is important.
Great. And we're hearing that NYIT on Long Island has a rock steady Monday, Wednesday, Friday mornings virtually. So that's great information. Thank you. And then hopefully we can put out some more virtual links that we know. And I know some of the physical therapy centers are actually starting some virtual sessions, both PT, OT, and then even LSBT and speech. So that's great. I think in this situation and day and age, a lot of us can't help just sort of enveloping ourselves in the news and it's just 24/7 all around us. And I think, that can often do more harm than good. And depending on how, people get wrapped up into it. What are your recommendations? Should people take a step back? I mean, should they just sort of, how do they process everything?
Yes. Yes. Yeah, I think at the beginning when everything was unfolding so rapidly, it was so easy to stay caught up and sucked in it and having it in the background 24/7, even if you're not paying attention to it. And that might very well be the case now. Of it's still on, it's now this new habit, and I feel like I need to not miss anything. But again, that's probably impacting quite a negative mood as well, or feeling pretty down about current circumstances. So aside from there's one thing that I want to point out about the what ifs, or spiraling kind of into the future and getting really anxious about what does this mean for retirement? What does this mean for all of these other things that are impacted outside of just even current employment, health, whatever it might be. Apart from just limiting the amount of content, whether you're like, I'm going to choose an hour in the morning and 30 minutes of the nightly news, whatever it might be, there's this thing called scheduled worry time. And it is really impactful and evidence-based for anxiety-specific diagnoses. And it sounds counterintuitive, but it encourages you to intentionally worry, not too close to bedtime. But if you also notice that when it is your mind is the quietest at night and your mind starts to race with all of these what ifs, having a scheduled worry time during the afternoon would be really important. And this means picking a place in your home, whether it's a chair with a journal, a corner, a designated place that you can choose to compartmentalize and say, this is the place where I'm going to choose to worry. And setting your timer again, 20 to 30 minutes, and say, I'm going to intentionally worry about all of the things that are spinning through my head right now. And this might mean teasing apart what's in your control, recognizing the things that are like, okay, yeah, this is concerning, but it's entirely out of my control. I need to let this pass. And then maybe starting to problem solve some of the things that are like, okay, this is what I can control at this moment, and this is how I'm going to break it down. Because all of the uncertainty of the future, uncertainty is so entirely out of our control. Bringing it back to what can I do in this moment about that and try to problem solve it. Once that timer goes off, I would close up the book. I would try to go on with your day. And when you notice these thoughts starting to flood in again, you can tell yourself, I have a time and a place for this. And I will choose to worry about that the next day at my worry time. And what people notice is that not only do you start to habituate to your anxiety, you're exposing yourself to these worst case scenarios, your anxiety is starting to go down. It doesn't spike as much when you continue to expose yourself. But also, if you can't recall, like, oh man, what was it last night that I was worried about that I said I would worry about today? That is a really good indication to be reminding yourself, okay, the next time I have a worry like this, should I ask myself, is this going to matter 10 minutes from now, a day from now, a week from now? And if you can't recall it the next day at your scheduled worry time, those are the thoughts that maybe we should allow to be more mindful of letting come and go through your mind.
Excellent. One of the things I'm so proud of with our center is that we take lots of different approaches. And, for any patients of mine who are on, which there are a couple, know that, meds are a big deal. If we, when we make a decision to start a med or change a med, there has to be really a good reason, and we discuss it. And, it's a very comprehensive approach. From a psychologist's perspective, what are your thoughts on medication for things like depression and anxiety? Can people stay away from medication or not take it if they go through routes like CBT or other, kind of psychotherapy programs?
Yeah, I think it's really case by case. I think a lot of people will come into start appointments with me and say, I don't want medication at all. I really want to give it a shot with just therapy. And of course, that is certainly okay. We'll give it a shot. And if it seems as though, symptoms are a little more severe than we had anticipated, or some of the materials just not sinking in, it's a good time to introduce medication as well. And what I notice is that with pairing it with medication, symptoms can go down enough to be manageable so that individuals can be exposed to the content of therapy and allow more of the material to sink in and be able to practice. So again, case by case, but really willing either way with what the patient wants in that moment.
Sure, so very individualized. Well, thank you so much. Dr. Gopal, Brian, do you want to kind of give your insight words?
Oh, you're muted.
We're at the end of our presentation now. I'm going to share once again where you're going to be able to see this excellent content that we presented today for your friends and family. Once again, on these various social media accounts that you can share this, email questions. We will answer them accordingly. This has been a great hour. Certainly, mental health is brain health, and brain health is body health. And, you know, body health can't be done, as Fiona and Shannon says, without paying attention to our brains and our emotional states as well. The good news is that there are ways to deal with this. There are methods to overcome these adversities, that we aren't living in a bubble by ourselves, that no matter how much isolation has to occur due to something like a pandemic, we are actually more connected than we have ever been in any other time in history. And these are positive things. And just to remind everyone on this call that even in times of great crisis, there are opportunities and chances for things to really grow and expand from here. And I suspect that this will be no different than any other crisis that we've ever faced in the history of man, and that there will be good that ultimately does come out of this. So anyway, thank you for joining us today. I really do hope that this was useful for everyone, and that people stay healthy, stay safe, and continue to grow. Okay. Thanks very much, everyone. Take care.
Bye.